Hello, everyone. Welcome to another exciting episode of the Revenue Innovation Series. I'm Dan Murdoch, your humble moderator. Today, I'm actually joined by two RCM rock stars. We've got Nikki and Becky joining us today. Super excited to dive into a very topical issue for many RCM teams across the country and much more. And so, without further ado, I'm going to hand it off to Nikki for a quick introduction to who you are, what you do, a little bit more about your RCM career, and we'll then hand off the reins to Becky to go next.
Sounds good. Thank you. So I'm Nikki Noyes. I've been in the healthcare industry since 1997. And so I've seen all of those changes for years. Also, I'm only 29. So just remember that. I'm not trying to age myself or anything. So um, I found in the RCM department, a lot of people start out the way that I did. So I started out as a receptionist. Then I did work in billing, coding, got coding and billing certifications. I did back work in clinical back, so like nursing stuff. I from there worked my way up into leadership, so doing more management type roles. I started out in private practice and then worked into running clinics for critical access hospital. And then after that, I am now in federally qualified health centers, which was kind of a new, crazy experience. But I have found that through the experience and all the different pieces of the revenue cycle is even more than my education. That experience and learning the little details and the pieces of the RCM world and revenue cycle experience has been what has driven me and really given me my passion in leadership in the RCM world.
Amazing. And Nikki, you were mentioning before, it's the devil's in the details, right? With respect to RCM success and failure. Becky is no stranger to any of that. I have the privilege of working with her at Adonis. And Becky, with that in mind, why don't you go ahead and introduce yourself next?
Awesome. Well, as Dan shared, I'm Becky. I'm the head of RCM here at Adonis. My role at Adonis has been focused around overseeing the delivery of services for the customers where we provide our service offering with our software too. But prior to working with Adonis, I was actually working predominantly with single specialty provider groups, much of it spent in the behavioral health space, working with a few different digital health giants on that side of things and building out RCM functions there. Prior to that, working in person, similar to Nikki in the FQHC space, it's definitely one that's the devil in the details with FQHC billing. But I've done hospital billing, pediatric, geriatric, pretty much if you can put it on a 1500 form, have either overseen the submission of it or done the submission of it myself. And so when the opportunity to come to Adonis presented itself, I was incredibly excited. And Nikki, I'd be curious your thoughts on this as well. I feel like a lot in the RCM space is very much you get what you get and you don't get upset. And it's a lot of needing to be able to make magic happen with limited tools and limited resources. And so the piece that brought me to Adonis and what I'm doing today is more so around the opportunity to help build the tools I wish I had always had in the areas where I felt that unfortunately as someone in RCM that are kind of lacking. And so having the ability to help, not just what I wish I had, but others that are in a similar space like Nikki and others that we've connected with around how do we make RCM easier? How do we set these provider groups up to actually get paid for the services they're providing?
No doubt about it. All right, so we've got an incredibly experienced crew here, although that is not a leading indicator of age, as Nikki put it. This is a youthful and vibrant crew. And so
that's right.
With that, why don't we jump into a little bit more of the problem, right? And the challenge that's at hand. We recently conducted a survey that accumulated the results and the sentiments of 110 different RCM leaders across the country. We found that 61% of those respondents said that denial and underpayment management is their top RCM challenge in 2024. Why don't we kick it off to Nikki here? Can you tell us a little bit more about why this is such a pervasive challenge and why it's more important now than ever to stay ahead of denials?
Wow. So that when I read that percentage, I was blown away. That's exactly what we're seeing in my company as well. And I really think, I really want to blame payers. You know, they are making it harder. All right. I'm just placing some blame here, people. It's real. Everyone is watching this. You know what I'm saying. Okay. There are more, we have to place more edits on claims before they go out, just so we can try to get a clean claim, not to mention all the denial codes that are coming back in that we have to take care of. Because every payer, they have different plans, and within those plans are different policies for the benefits for every single member that they have, right? And so, and it's not, none of it's the same. And so you have to try to keep your team apprised of all the different policies within all the different plans, because they're going to deny it. They all want their own medical necessity. And all of this is capturable. All of this is avoidable in the front end, if we can catch it. And then in the back end, as these denials come in, part of the problem is sometimes the denial reason that you're getting might not be what is actually happening with the claim. And so what we have found is, if you can trend it, if you can find a bunch of them that are coming in for the same reason, then you can pinpoint that, correct it at the front end. That was a long answer.
But a good one, and I think Nikki touches on a couple different things that I know are tried and true and passionate for Becky and team. So Becky, why don't you go next in terms of why is underpayments and denials such a universal and common enemy of an RCM team?
Yeah, absolutely. I think on the Adonis team, we're in love with our analogies. So I'll give you one that I think of when I look at underpayments and denials and what they mean is, have you ever dropped your phone and it broke and you just wish you could go back 30 seconds to just not drop your phone? And it's something that I think when you spend time reviewing denial data, when you look at underpayments and where you haven't received that payment, there's a layer of pain when you're looking at avoidable denials versus unavoidable denials, and then recoverable denials versus non-recoverable denials, and seeing those opportunities where on the front end, improvements to eligibility, improvements to prior authorization process, improvements to referrals, improvements to patient qualification. How do we make sure we're seeing the right patient, they're seeing the right provider, we're verifying their benefits, that everything is in place prior to that service? When you see those denials on the back end, it's so painful because it feels like that opportunity of like, oh, if I could just go back to that day and do it differently, would I be looking at this denial? And I think that's something that a lot of people are feeling the pain around. And I think that translates as well over into the underpayment side of things. I think to Nikki's point, there's a lot of reading between the lines as to why things are happening. It would be just too easy if they told you exactly what was wrong and how to solve it. But oftentimes you see these left field adjustments on why you're making less money than you anticipated receiving from the payer. And now it's your job and diligence to go find out. And what is the opportunity to learn from those, to carry that into the future and treat it much more like a feedback mechanism. And I think that's where the pain comes from, is how do you make this avoidable in the future, knowing that they continue to make things more complex and staying on top of it.
And is there anything within the current state that's sort of preventing RCM teams, in either of your opinions, that it's one thing to identify the denial and then try to pattern recognize where it's coming from. But in the current state of affairs, whether it's technological or commercial and relationship driven, and payers are just always sort of going to be in the position of trying to deny and deny and deny. What do you guys think is an underlying issue that is maybe contributing or exacerbating this challenge and maybe preventing RCM teams from being on the operational front foot as it relates to mitigating denials at scale?
Happy
You
to
want me to go
start,
first?
Nikki,
Oh,
or
yeah, go ahead, Becky. No, go ahead. Yeah.
I think this lives in a few places, and that's what makes it difficult. Is for many providers and their practices, this lives within tribal knowledge, or they have their golden biller who's been with them, 10, 15, 20 years, who knows everything, every little detail and every little payer need. And the questions become, where does that live at scale? How do you take that knowledge that and make it so that, let's say your golden biller wins the lottery and decides they're never coming back to work, which great for them, but not so great for the provider that needs to be able to pick up those pieces. And so I think the very manual nature of how information is disseminated through the RCM industry as a whole, of it's almost anecdotal, of like, oh, well, I heard this one thing about United Healthcare, so now I'm going to change how I bill these claims. And who knows where you find that information and how you learn it. And so I think that's one aspect, is there's really no great overarching opportunity, or no, often people don't see an overarching opportunity to have that information at their fingertips to say, this is the information my team needs to do this. This is how we can apply it in an automated fashion so that they don't even have to think about it. It's just part of the existing tech stack, ideally. And so I think that's a very big piece, is too many things live in too many siloed places, and how do we create a better knowledge share for the team?
And that's not just people, right? It's data. It's all the things seem to exist in pockets of knowledge, or pockets of answers or clues, but it rarely sort of seems integrated. But Nikki, you're gonna say something as well. Please feel free to jump on in.
So I love that you said that. The golden biller. That's so true, right? We have these people who have been around forever. They know all the things, and you never want them to leave. That's real. What Dan was just talking about with the data, because we've moved from, I'm going to age myself again here. We've moved from paper, right, into these EHRs and into the technological world of healthcare. And there's so much data, and there's so many pieces that we could have access to, and there's so much information there. And so what we found has been difficult for our team is, we know there's an answer in our data. There's got to be a way to get to it. And we have a really great EHR/EMR system, right? We use Athena. And it's great, but we still can't get to the information in the way that we need to. It isn't organized the way that we need it to be organized. There are certain pieces that we want to grab and put in a different place, right? And how do we make all that, how do we take all the data that we're given, and then how do we make some sense of it, and then how do we get it to all of the team? Because I might have one biller who is outstanding, and she's learned these different pieces mean X. But then how do we make sure that, how could we turn that into a report? How could we turn that into information that's easily accessible for everyone? That is where we really have struggled. And I think for the future of RCM, that's really what we're looking at. Yeah, there you go.
We subscribe to the same thing, Nikki. We believe that the answers live within the zeros and ones of your data, and could put your teams into a position to understand not only where the denials are happening, but what is the underlying cause, and how does that inform changes strategically or operationally or otherwise. And I think this is probably a great transition to our next question, which again, I'm going to refer back to our research for a moment. It found that RCM teams who are using BI or analytics tools to track revenue cycle performance, 83% of them don't feel like that tool enables them to mitigate denials or make strategic decisions. And Nikki, when you spoke, you said basically to the effect of like, you can get access to some of the stats, but it's not useful, or it's not telling you a story, or it's not informative. Help us, learn a little bit more about your stance there, right? I think it's about building off of what you just mentioned before, which is if you had access to the data and then in turn had access or had a platform or a tool that could help you articulate the story behind that data, that would be tremendously helpful to you all. But certainly would love to learn about how you're interpreting today and what you imagine the role of like those tools could help you in the future potentially.
Of course. So I'm going to sound super frustrated with this. Everyone be warned. I promise I won't use any 4-letter words though. So we've got this denials report. It's the best thing I can get out of our system. And as great as it is, I have dumped that bad boy into Excel and I have ran pivot tables on it and I got all this information everywhere and I'm charting and I'm graphing and it has taken me hours. So instead of doing all of these complex issues and all this director of revenue cycle stuff I got to do over here, I am filtering a report and I am trying to help my team be able to work this information. And yet, even with all of that data, I cannot figure out how to make it actionable. I can't make this report that I've created. I mean, I can say, I can pull the report so that I can see that 62% of my claims are coming back because of a front end denial. Okay, well then I got to figure out within my EMR, what does front end denial even mean? So then I got to filter out all those denial codes. What do they mean? Well, then I got to filter out, okay, well then which insurance companies are they coming from? Is there a trend? How much money is there? Now, Athena does some of this for us, but is it actionable? Can I pull my 5% trending claims from Blue Cross of Idaho for this one denial reason? Can I pop them up? Can I take a look at them? Can I click into them, hurry and fix them? Then can I write something so that next time these pull in, we know what they're doing? And then maybe I got a bot that can fix it for me? No. And it's literally making my brain bleed out of my ears. I can't even tell you. If all of this manual stuff, I know I'm setting this up for you guys like a home run, okay? But it is literally what we are looking for in the RCM world. Okay, how can we take this manual work away from our teams so they're doing all the critical thinking, all the complex work on these other claims? It's huge for us because we've done the root cause analysis, right? We know what we want, we know what we're looking for, but we can't make it happen on our own. There we go.
Fire away.
All right, take it away, Becky.
The piece for me that like I've experienced along with you, Nikki, like I was smiling through I think everything you shared because I have absolutely lived that world where like pivot tables become your saving grace because you can't get what you need to drill down into the data in a way that scales. And so here you are spending valuable time working on these reports. I've done it. I know I've had conversations with other customers who, well, my Saturday plans are to go through and run pivot tables. And so I think where that stems from is, I think for some existing things, mainly because I know what Adonis offers, but for some existing offerings out in the space, there's a failure to acknowledge the different perspectives that exist and who needs to understand RCM data in different ways. And I think of it from a few perspectives of having worked in Athena. Their reporting does great in driving needs for RCM knowledge from like a finance or executive level out, and they do that very well. But when you start to look at how do you manage a team against that data, how do you monitor that team's productivity, how do you start to set that team up to move forward through what the next stage of whatever that data is telling you, there's room for opportunity. And so I think the piece is, and what we've found incredibly important is, let's talk about how we're pushing data forward for different perspectives. Can we offer an executive view that they want the fastest glance possible of, great, let's see that AR bucket trending down in a way and claims are getting paid, and I can look at that in 5 seconds and know this is going great. But let's also not forget about those that are actively in the work doing it and responsible for those outcomes. What do they need in terms of how to drive movement and productivity on their teams? And how do we start to provide that opportunity of almost that first forensic layer of, great, this data is awesome. What do I do with it? And providing those suggestions and pointers of, hey, we're seeing that there's a mismatch between the code and the diagnosis code that's being used, and it's creating all of these medical records denials. They're coming back as needing medical records. Reality is that it's a coding problem. How do we push that to a team to be able to say, hey, all of these claims that are having this exact same problem, go fix these all exactly the same way, and here's a concise list to be able to track those. And that's the piece that I think externally, outside of what we're doing at Adonis, becomes a pain point of, how do you take individuals that you're bringing on because they're your golden biller and they know everything under the sun and they borderline invented electronic claims billing for you,
Yeah.
and enable them to do the things that actually are important, as opposed to the very data entry tasks or these discovery tasks of, go spend 45 minutes on the phone with a payer and find out why this claim didn't pay. That's tedious. Nobody wants to do that. And we don't want to, be directing people to do that. And so when I look at a lot of the dashboards that exist out there, from an RCM perspective, I can absolutely understand the feeling that they're not providing the insights necessary to move things forward, because I think the question there becomes, are they actually meant to do that? And, are they taking the appropriate persona or view in consideration when providing that?
So much gold there from both you and Nikki. If I'm just summarize, right? It's a step in the right direction to be using a best-in-class EHR system and having reporting at least available to you in its out-of-the-box format. But I'll borrow a healthcare analogy here. It's great to know that you have a fever, right? But what are the underlying symptoms and causes that would allow you to render a proper diagnosis to the issue at hand, right? Why is my RCM operation potentially ill, right? And that's where the existing solutions today are sort of failing RCM teams. And that's in the range of, how are we staying ahead of ever-changing payer regulations? How are we staying on top of the trends that may or may not be emerging? And what are they an indication of? How do I ensure that we're meeting prior authorization and eligibility requirements, right? All of this plays such a significant role. I'll pose one more question to you guys before gathering sort of final thoughts here. Whether it's front, middle, or back end RCM, do we think one or many of those areas are the biggest contributors as it relates to driving an increase in underpayments or denials, or do we think it all sort of lands squarely on the payers? Either one of you are welcome to kick us off with an answer.
My computer was dying. I think the piece that's important is like the enablement of the team. I think payers are going to continue to do what payers have done for years. And I think with increasing cost of living, with complexities and introduction of new technologies, their rules and regulations and the hoops that you jump through in order to get paid as a provider will only become more complex. And so I think it's the responsibility on those looking to support individuals in the RCM space. I think it's the responsibility on the provider groups to set themselves up in the position to be aware of those things and be prepared for what's coming and start to be looking more forward. I think so much of what happens in the RCM space is reactive. You're waiting, 14 to 45 days to get a remittance back, and you don't have that data until it's available. You're waiting until the next set of rules come out. You're waiting until the next quarter until insurance companies make decisions about coding, those types of things, where I think it's almost a little bit time for the provider groups and those supporting in the RCM space to fight back a little bit of, how do we start to reimagine this and look at this from a different perspective of, we're going to get ahead of this, and there's a proactive opportunity here that needs to be taken advantage of.
I love that you use the word proactive. It's actually in our mission, proactive healthcare for our patients. And the way that translates down through RCM is we've been trying to really rethink, redesign the way our department functions so that we are being more proactive. Because you're right, reactive is how it has always been. And moving forward into the future, you can't continue to think that way, because it will continue to become more and more complex. The way we're seeing the policies, the way it's all working, it will continue to work that way. And so instead of continuing to complain about it, what are we going to do about it? What kind of action are we going to take? And so I think being proactive and finding ways to empower our teams to work the issues that we see that can be worked ahead of time, prior authorizations, our eligibility checks, our NCD, LCDs, the medical necessity, right? All of these pieces that can be attacked from the front, thought of, planned for from the front, that needs to be done for sure.
Amazing. Yes. And I think like this has been such a tremendous opportunity to hear from folks who are living this every single day. And so Nikki and Becky, thank you so much for taking the time and sharing both your challenges and what you think the solutions are to those challenges. I think like there's an element of transparency and honesty around this whole equation, and there isn't a silver bullet, right, to this
I
problem.
really wish there was.
I know. I think we all do. Yeah, I would help all of us sleep better at night, certainly.
I would just take that pill.
Yeah.
I mean, if one pill could fix it, man, I will take one for the team and I will take that.
Yep.
But there's not.
No doubt. Yep. We're right there with you. Now, at Adonis, we're trying to take a step in the right direction of assisting and empowering RCM teams to do this and much more with respect to putting teams on the proactive as opposed to the reactive. But we have much more work to do. And, thanks to folks like you, Nikki, and others, we're taking meaningful steps in the right direction. So just to conclude, again, thank you guys for joining us. And if you're interested in watching other Revenue Innovation Series episodes, speaking to you now, audience, please feel free to check out Adonis.io. And if you'd like to get in touch with Nikki or Becky, feel free to email us at marketing@Adonis.io. We'd love to connect you guys. Again, thank you, Becky and Nikki, for your time, and we'll catch you all next time.